All right, so I'm going to talk today about NSSI among sexual and gender minority youth. I'm realizing here. Okay, so I think we all have had a long understanding that sexual and gender minority individuals are at greater risk for negative health outcomes. But despite this, in 2011, the National Academy of Medicine looked at the literature, the state of the literature at the time, and they concluded that the existing body of evidence is sparse and substantial research is needed, specifically on sexual and gender minority health. And more recently, in 2016, the NIMHD and AHRQ officially designated sexual and gender minority populations as a health disparity population. And the idea behind that is to spur further focus on this issue and hopefully to help address and reduce disparities. So I think an important starting point is to first accurately characterize the scale of this issue and related to that to help hopefully characterize trends over time, temporal trends in these disparities, and thereby monitor our progress in addressing them. And these disparities include both physical health conditions and mental health conditions, among them non-suicidal self-injury. So toward this end, some colleagues and I in my lab have looked at the state of the literature on NSSI among sexual and gender minorities systematically across the literature. So we conducted a systematic review and meta-analysis, and across 51 articles that we identified, there were 54 studies on this specific issue. So I'm just presenting a couple of the findings that we've had in this literature review. So the first one is looking at simply the prevalence, the lifetime prevalence of NSSI across different sexual and gender minority groups and comparing them to heterosexual and cisgender reference groups. And K is the number of effects that we identified, and the N is the pooled number of participants across all these effects. And you can just see from the data here that it's quite pronounced. We're seeing 2 to 3 times as many or more prevalence of lifetime prevalence of NSSI across different gender and ethnic minorities. And you only have to look at the p-values. The confidence intervals don't converge or don't overlap, I should say. And among these groups, the bisexual and transgender populations seem to be at particular risk. We also looked at analyses to look at what would be moderating this association. And one of the strongest moderators we found was age. So what this means isn't that adolescents are at greater risk of NSSI compared to adults. That we have known pretty well in the literature. What this is saying instead is that sexual minority status, the association between sexual minority status and NSSI is stronger among adolescents than it is in adults. And this suggests that among adolescents, the disparity might be greater in terms of NSSI. So sexual and gender minority youth might be doubly at risk for NSSI on account of being an adolescent and on account of being a sexual or gender minority. So it really speaks to the need to, particularly in this group, try to characterize trends and also to help identify what might be driving this disparity. And towards that end, oops, wrong direction. Towards that end, I conducted another analysis looking at temporal trends in NSSI among sexual minority youth and heterosexual comparisons. Now, there aren't that many data, unfortunately, available to look at this. There's currently no nationally available, nationally representative data for this, but the YRBS is a nationally representative data set that's administered every 2 years. There's core sets of questions that are asked across all the states. But in addition to that, individual states can ask additional questions that they themselves think is particularly pertinent. So the Massachusetts YRBS has since, I believe it's 1995, been asking questions about sexual identity and more recent about transgender status. And so they've been particularly, I think, ahead of the curve with regards to this. And the national YRBS has now, as of, I think, last year, the year before, been asking that across at the national level. And as of, I think it's 2005, they have been asking about NSSI. They're one of the first states in the YRBS system to do so, and again, being a little ahead of the curve with regards to that. And so the Massachusetts YRBS might be particularly useful for looking at temporal trends, at least at a population level. And so that's exactly what I did in this study. And I looked at minority status across 2 different indices. looking at sexual identity and same-sex behavior. And the reason for that is some people who engage in same-sex behaviors don't necessarily identify as a sexual minority. And at the same time, some people who do identify as a sexual minority may not have engaged in same-sex behaviors. So in this study, it's looking at NSSI across a 12-month period, has the individual engaged in NSSI for the past 12 months. And I employed joint point regression that's specifically designed to look at temporal trends. And what I found was that in terms of prevalence rates across this 13-year period from 2005 to 2017, you see the range in prevalence for heterosexuals is from 11% to 20%. Among sexual minority youth, on the other hand, it's 38 to 52%. And looking at temporal trends here, you see that there has not been a substantial decrease, not a significant decrease in NSI prevalence across these years for sexual minority youth, regardless of how you classify sexual minority youth status. However, in terms of sexual identity, we see that heterosexual youth, there has been a significant decline in the prevalence of NSI within this data set. In terms of sexual behavior, I tend to give a little less weight to that among youth just because there's potential confounds looking at sexual behavior. We know that early engagement in sexual behavior, like a 13-year-old engagement in sexual behavior, is itself associated with negative risk outcomes, including NSSI. And so that could potentially help muddy the results there. And early sexual behavior is also associated with sexual risk-taking behavior. It's self-associated with negative mental health outcomes. So for those reasons, I tend to give I'm a little more cautious in terms of interpreting those results. So that's pretty much it. And I just want to thank my collaborators. Some of them are here in this room in terms of helping with the studies, and CEC for the data that I used for the YRBS, and the APF for funding the study.